Hello, I'd like to welcome you to this short video about facilitating small interprofessional groups of students. My name is Patricia Otaki, and I'm the Assistant Vice President for Interprofessional Education here at UB. First, I'd like to thank you for volunteering to be a small group facilitator for this interprofessional forum. The success of this educational experience for our students rests on the commitment and quality of our small group facilitators. The purpose of this video is to assist you in preparing to serve as an interprofessional facilitator. This video will present some tips for successful small group facilitation and also describe additional considerations for facilitating interprofessional groups of students. So let's get started. Tip number 1, and this is really the most important tip: listen more than you speak. We are all used to being educators, and we are used to being the person who is sharing the information. But facilitating a small group is an opportunity for us to step back, guide discussion, and listen. Certainly interject is needed, but only to guide the discussion and keep it on track. Tip number 2, do not lecture. Focus on listening, and again, guiding your group as needed. Tip number 3, foster curiosity and excitement. Be sure the students know you want to be there and you are really excited about being part of this interprofessional forum. Help generate excitement in the students in your group. Tip number 4, promote thinking and problem solving. This is often done really well if you ask a probing question and encourage discussion. Tip number 5, create a respectful, non-threatening environment. Students will speak much more easily if they feel comfortable and safe within your group. Tip number 6, encourage interaction and collaboration. See if you can find ways for students to understand how they can work together to complement each other's practice. Tip number 7, provide direction without making decisions for the group. Of course, it's important to give a nudge to the group to keep them moving in the right direction, but allow the group to make their own decisions. Tip number 8, provide encouragement and support. Not every student is going to be jumping in and participating. Be sure you are aware of who is participating, encourage those who are not participating, and support all students equally. Tip number 9, encourage diplomacy and address conflicts. This tip may be useful in a situation where you need to quiet some of the people who may be dominating your group or students who may not be showing respect for other students in your group. It may be useful to ask a student, can you explain why you feel this way, if they express hierarchical opinions, for example. It is important to maintain an atmosphere of respect within the group. If there are conflicts, try and find some neutral ground. Thankfully, we've observed very few small group conflicts in the past, and we're hoping it will continue that way. Tip number 10, stimulate discussion if necessary. If your group is having difficulty getting this discussion started or keeping the discussion moving, you might find these strategies helpful. Consider asking the group, what would happen if, or in your experience, and then fill in the sentence. Perhaps you could say, tell me about, and keep the question open-ended. Or what do you think about, and fill that question in. Another example is, what ideas do you have? For the quiet students, you may consider speaking to them directly by using their name. So insert their name. You've been quiet. What are your thoughts? So now that we've talked about 10 tips for how to be a great facilitator, I'd like to offer you 9 more tips for how to be a great interprofessional facilitator, because there are some unique aspects when facilitating interprofessional groups of students. These next tips expand on your expertise with uniprofessional groups by highlighting the differences when the group is interprofessional. These tips fall into 2 categories: considerations related to students having different professional backgrounds, and the concepts of interprofessional collaborative practice. Tip number 1, be professionally neutral. We all have a passion for our own profession. That's why we're in our profession. We want to be sure that as we facilitate an interprofessional group of students, that we are professionally neutral and that we value all professions equally. Recognize diversity in students' backgrounds. Tip number 2. Although every student should be at roughly the same point in their education with respect to academic and clinical preparation to be participating in this forum, there will still be differences in their knowledge in different areas. It is important that you recognize this and encourage students to share their professional perspectives during the discussions. Tip number 3, be aware of perceived professional hierarchy and stereotypical beliefs about professions. For example, gender, status, caring, power. If you are aware of hierarchy or stereotyping, be sure you address this in the group. Ensure that the students aren't deferring to some students in the group because of their profession. All students should be on an equal playing field during the small group discussion and recognize that all students have a role to play in the care of patients. Tip number 4, realize students may lack an understanding of the roles and responsibilities of other health professionals. The students have watched short videos and completed online modules about the roles and responsibilities of health professionals in preparation for this forum, but they still may need some clarifications. So during the discussion, it might be a good opportunity to make these clarifications about the roles and responsibilities of other health professionals if some confusion seems to arise. Tip number 5, value the distinctive experience and expertise of each participating health profession student. Every student is going to bring different expertise and experience to the group, and it is very important as a facilitator that you are valuing each student's contribution to the discussion. Tip number 6, celebrate diversity. Understand no one profession has all of the answers for a patient or client. It is important that we realize as healthcare providers we need each other. Healthcare has become so incredibly complex that we can't effectively manage a patient optimally without relying on our other professional colleagues. Tip number 7, clarify professional jargon. We all have a unique professional jargon, and it is important that we try to limit our use of our professional jargon so that we all understand each other. If it appears as though many of the students are using their professional jargon, it is important for you as a facilitator to both clarify some of the words being used, but also encourage the participants to limit the use of their jargon. These next 2 tips focus on interprofessional collaborative practice. So tip number 8 is to understand and encourage discussion around the 4 competencies of interprofessional collaborative practice. These competencies are values and ethics, roles and responsibilities of healthcare providers, interprofessional communication, and teams and teamwork. Feel free to ask the students about the core competencies and how they're being applied to this case discussion as they develop their plan of care for the patient. Throughout the discussion, continue to reiterate the value of interprofessional teamwork and communication to the students. It is important to help the students recognize that through this small group discussion, they're engaging in an interprofessional collaboration. And finally, tip number 9, promote the benefits of interprofessional learning for teamwork and link effective team collaboration to patient care. It is so important that our students learn how to work together and to collaborate. Strong teamwork is associated with reduced medical error, improved patient outcomes, and strengthened healthcare systems. Teaching our students teamwork skills while they are still here at UB will facilitate their success as a team member in the clinical setting. Thank you so much for your attention to this brief video, and we look forward to seeing you at the Interprofessional Forum.